watching 8 News Now at noon.
Welcome back. Eugene Somphone joining us here from the medical director at Southwest Medical Associates. We're talking about telehealth services, telemedicine. I'm talking about the fact that since 2014, you guys have had 30,000 virtual visits. This really seems, medically speaking, in terms of medical care, almost like the wave of the future. What is happening in this area of the field? Tell us about it.
So first of all, telemedicine comes in many different forms. So at Southwest Medical, we offer a direct-to-consumer brand where consumers can access a provider in life-threatening conditions. It's through via secure video chat, much like Facebook. The connection time is about 5 minutes. And generally speaking, we can make a diagnosis very quickly. If a prescription is needed, we'll send it to your pharmacy. And so since 2014, we've done nearly 30,000 virtual visits.
30,000. And what stood out to me, a stat I was just reading, 27.6% of the visits, the total e-visits, come from patients older than 65 years of age. So we know the young people are very savvy with technology. That stat is surprising. It shows that everyone is expecting this online e-care, if you will.
It really is. It's really about adoption. 10 years ago, we wouldn't have thought about online commerce, online dating, purchasing online, and much the same way telemedicine is heading in that same direction. So in a few years, maybe 5 years, 10 years, I think most folks, instead of driving down to urgent care, would think about telemedicine and grabbing their smartphone.
Talk about, you have 600,000 eligible members that you're able to reach. What is an e-visit? You're essentially sending an email to the doc.
Exactly. So these are people who have an established primary care through Southwest, so they can reach their provider through a secure a secure email. The turnaround time is about a day or so. And we do about 5,000 e-visits per month, of which about a third are for seniors.
What are some of the other benefits of being able to access health care, access health records 24/7?
Yeah, I'll tell you, so that's so important nowadays because for a physician to not have access, you're in a loss, you're in the dark. But have access, you know exactly where they've been hospitalized, their medications, the last time they saw their primary care. At Southwest, everything's all bundled. So we share the same electronic health record as our telemedicine, as our hospice. So it makes it much, much more meaningful and actually much more safe for the consumer.
Incredible. People able to reach out for that health care in a multitude of ways. Thank you so much for the information, Gene. If you want to get more of it, it's always available on LasVegasNow.com. On 8 News Now in just a couple minutes.